Very cool.
Yes.
Excellent. Well, again, back to the whole reason why
Obamacare.
we wanted to have you back.
Yes.
Was Dr. Bernardi, of course, very outspoken about Obamacare and the effect that it's having on the whole industry. And he had spoken with you off air about your thoughts.
He
Go ahead,
had a
Kimberly.
couple of specific questions because I reached out to him on the phone. And, his question was, what do you think about the changes in medicine since the onset of Obamacare? And how is it affecting your practice? And have you lost any patients?
Sure. Well, since the first thing I want to mention is the lack of transparency, accountability, when they rolled this out. And, when it was first rolled out, they said that they had all these people that signed up through the website was actually overinflated.
Yes.
Some were double counted by 300,000 patients. So
Some
that
were
really
dental.
wasn't transparent. And about the affordability, we're now finding out that it's actually costing my patients more and at the same time limiting their ability to access health care. To give you an example, I'm one of few ENT physicians that accept that health insurance
Okay.
in the area.
Right.
But if I need to operate on that patient, I can't because I don't have privileges at the hospital that insurance company has aligned themselves with. So that limits the care I can deliver to these
Right.
patients.
And let me ask you this. Why are you one of the few? Why don't
Right.
the other ones get involved?
I think most other ENTs, well, I'll assume, I don't want to speak for
Speak
my
for
other
them.
colleagues,
Right.
but
Sure.
I think they just don't want to be involved with the whole Affordable Care Act for principle.
Yes.
I kind of look at it as in a viewpoint where these patients need somebody to take care of them, whether they're enrolled in another private insurance carrier
Right.
or Medicare or the Affordable Care Act. They don't have anywhere to go.
But how good is it, though, when you see them and you're able to do everything up to a certain point, and then when it comes to the actual surgery that they need, and probably with you, how does that make you feel knowing that your hands are tied?
It's the opposite of why we entered medicine. We wanted to be able to help our patients and have no limitation. But in the back of our minds, we always want to limit costs.
Right.
We always want to limit procedures, do no harm. But we're handcuffed. And I'm frustrated. The patients are equally frustrated. And then they have to start over. They may
Right.
have to find another physician that accepts it, that goes to the hospital. So they start all over again.
Well, then is it really beneficial to the patient if under the premise that they have insurance, they come to you to seek help, they get your guidance and your knowledge, and they're ready for what's going to really help them, and then, hey, you have to start over, and then maybe they're going to be at another doctor that's not going to offer the services that you do, and they may not get that, 98% satisfaction,
Exactly.
the success.
And that's a very big problem
Yeah.
that the patients are finding out after the fact.
Yeah.
And I emphasize after the fact.
Right.
Here's what gets me. And, I do know some people, people at the radio station. My wife manages a salon. She has some of the girls there that they're psyched about Obamacare. They think it's awesome because, they don't make a lot of money and they never really had access to health care. They think that it's one of the greatest things ever. What they don't understand, and correct me if I'm wrong, but I've been made privy to the fact that a lot of times if you have that affordable care, that's your insurance. You go see a doctor. Another patient comes in who has top of the line, great insurance, and you probably won't be able to comment on this because you're a doctor and you don't want to admit this. But I've heard as a rumor that the doctor's probably going to see the person with the great care first, insurance first, rather than the Obamacare person. So they're going to wait a lot longer. Is there any validity to that? Can you speak on that at all?
I think there may be some slight truth to that statement. I can't tell you that in my practice, and I won't speak for anyone else's practice, but I do think that there may be some limitations when there's an association with the Affordable Care Act or Obamacare,
Right.
which is unfair.
Yeah.
And it's not, but life's not fair,
Right.
unfortunately.
Right.
This is how it is.
Sound like my mother.
But, it is limiting.
Yes.
And that's the problem. And I think many of the American public were fooled by the rollout and by what it was going to give them from the beginning that you could keep your doctor if you like your doctor. That is not true.
Biggest lie of the year.
How much time do we have left in the segment?
About a minute and a half.
Okay. Well, then
We can roll it in the
after
next
that. We're going to
segment.
roll it. Yes.
Yeah, there's some great audio that we found. We were actually talking about it at length last week about the death panels and Jonathan Gruber and this and that. I found sort of a mashup on YouTube where they're, we all know that they were making fun of
Yes.
Sarah Palin when she came out and said, in quotes, the death panels, and that became an object of ridicule, and it
Only to find out it's true.
looks like they might be coming. So we'll roll that in the next segment. So you can hang out, right, Dr.
Sure,
Latore?
absolutely. Love to.
Well, what I've always thought, and Dr. Latore, maybe you can chime in on this, is that, we've always, since the rollout of Obamacare, thought, how can this be constitutional? How can the government tell you that you have to buy something?
Yes.
That just seems like something that, out of science fiction. How can they tell you that you can buy something? And then we've had attorneys on that have explained it went all the way to the Supreme Court,
And they said it's a tax.
and they ruled that it's a tax.
Yes.
So they're pretty slick with how they justify these things.
Well, first of all, they've covered it up without saying it is a tax.
Right.
And they've counted on, as Mr. Gruber said, on the stupidity of the American public. And the goal was to get this thing passed,
Right.
and we'll figure out everything later.
Right.
That was the whole point. And this was said, in a speech by Mr. Gruber. And the problem is that the American people were duped.
Right.
Yeah.
And now we're in the situation where if you use the word socialized medicine, that sends fear and shivers up everybody's spine.
Right.
That's why we had Canadians coming into the United States for healthcare and,
Yes.
and other nationalities coming in for healthcare in the United States. But now, in essence, what we're creating is a socialized medicine, whether we like it or not. And, I think the Obama people put the cart before the horse. And now we need to make some changes. And thank God we have a majority and now in the House and the Senate to hopefully sort of make some changes.